Very good afternoon to all of you. Thanks for joining us here on The Big Story. I'm Afrida Rahman Ali. We are going to take a closer look at the situation in Kerala, where the Zika virus is posing a new challenge to the district and the state administration, particularly in Thiruvananthapuram, where the highest number of cases are coming from. The recent outbreak of the virus amid the rising COVID cases has turned out to be a big public health concern for Kerala. Total of 18 Zika virus cases so far been detected. A 6-member team from the centre is in Kerala today to monitor the situation. The central team will support the state government in the Zika virus management. In the latest 3 more cases that were detected recently indicate that this is a virus that can infect all age groups. A 22-month-old baby, a 46-year-old man and a 26-year-old health worker are the latest cases detected. Kerala government has also received 2,100 Zika virus testing kits from the Pune's National Institute of Virology. So more tests are being conducted in Thiruvananthapuram, Thrissur, Kozhikode and the NIV unit in Alapura. So clearly the first case, viewers, was reported in a 24-year-old pregnant woman. She was a native of Parsala in Thiruvananthapuram. After that now, we have 17 more cases. The total confirmed cases as of now stands at 18. But let's remember that most samples are getting tested. Earlier, 26 samples were tested, which also came negative. So it is not as if it's spreading at a very fast rate, but then it continues to be a huge public health concern. In fact, to talk about the current situation and what is being done to deal with it, because the immediate priority would be to restrict the spread. Let's welcome Dr. Rajeev Jayadevan, Scientific Advisor of the IMA, the Indian Medical Association, and Dr. Sanjeet Sasidharan, who's the head of the Critical Care Department of the SL Raheja Hospital. Good afternoon, gentlemen. Thanks for joining us. I want to come to you first, Dr. Jayadevan. Big questions that are being asked now for the Zika virus is who is vulnerable, because this is spread by the Aedes mosquito. We do not know in a country like ours, where mosquitoes are, of course, something that is literally everywhere. How does one prevent oneself from getting infected? Right now, it's only in Kerala. But then again, going by past history, we know that this can spread.
Yes, as you said, viruses don't travel on their own. They need a vehicle to travel. We know how the COVID-19 spreads. It spreads from people to people through the air. Now, the Zika virus uses the mosquito as a vehicle to travel from person to person. So that's called a vector. The mosquito functions as a vector to carry the virus from person to person. And there is no specific medication or vaccine available now for this virus. The only treatment that is available is to stop us from being bitten by mosquitoes. So that is vector control or mosquito control, whatever you want to call it. You want to stay away from mosquito bites, particularly those who are vulnerable. You've heard that people who are pregnant or who are likely to get pregnant should take extreme caution not to get infected by this virus, because this virus not only affects the adult, but it can also affect the unborn fetus. And rarely it can result in what's called microcephaly or tiny head syndrome or small head syndrome, which is not just a cosmetic problem. It causes serious, irreversible, incurable neurological problems. So even though this problem is not much reported in India, it's more in French Polynesia and Brazil. We can't be too cautious about this. So therefore, mosquito control requires a lot of attention. Right now, I'm sitting in Cochin, Kerala. It's raining here, and mosquito-borne diseases like dengue and other diseases, they typically spread more during the rainy season because the mosquito loves to breed in fresh water. Even if there's a teaspoon of fresh water lying around somewhere, this mosquito breeds, and this is a day-biting mosquito. And herein lies a problem, because people are out more during daytime, and this mosquito has the ability to bite you without even letting you know that there is any mosquito biting you. You got to see it to believe it. It causes a classic painless bite. So there we are.
Yes, absolutely. And very important to note that, because of the ongoing monsoons, the rains, that leads to stagnant water. and they become breeding grounds. So the authorities, of course, have a huge responsibility now to weed out this problem of water getting stagnated. Already reports coming from across the country of many states where water logging is an issue because of the monsoons. Coming to you, Dr. Sasidharan, on this, since you are heading the critical care department, I want you to explain to our viewers on ground what are the kind of symptoms that are witnessed in those patients who get infected with Zika virus.
Generally, Zika virus is quite a mild related illness. The symptoms are something like fever, rash, a headache, a joint pain, something like red eyes, conjunctivitis, a muscle pain. These are the usual things that you basically get after getting Zika. The symptoms occur somewhere around 2 to 14 days after a person is bitten by an infected mosquito. It usually lasts about a week. Generally, most of the people recover fully, and as said, these are things that can be treated. Does not have a specific treatment, but it is all symptomatic management. But generally, these patients do get well soon on symptomatic management is what it looks like.
Yes, but how does one detect? Like, what would be the immediate signs and symptoms to look out for? And what should a person do if any of these signs are noticed?
Yes, so the symptoms that are seen are fever, a high-grade fever, a rash that develops all over the body, a headache, a joint pain, and red eyes, conjunctivitis, and also this is seen with the muscle pain too. So these are the general symptoms that you get, and this causes the patient to get dehydrated. The treatment for which is very basic paracetamol. The simplest drug to use is very basic paracetamol, and if there is high fever, to drink plenty of water. The important thing is drinking plenty of water and taking paracetamol. And anything more than that, you should be very careful, and anything more than that, you should come to the hospital and take help of a doctor, because drugs like non-steroidal anti-inflammatory drugs that are used rampantly might cause problems with the kidneys, and that is the time that you should probably visit the doctor. If after 3 or 4 fever after paracetamol, also if the patient is not improving, then it is important to meet the doctor, because you might get dehydrated and other problems might come in.
All right. So, are there serious concerns, is what the viewers would want to know, Dr. Jayadevan, because you mentioned that in certain cases there can be neurological consequences. Has there been any such case, that we can talk about, which indicates that, yes, this is a virus which cannot be taken lightly. Enough and more needs to be done to prevent its spread.
Yes, this virus definitely cannot be taken lightly. What I'm implying here, there's no need to panic. But as you rightly know from our past experience over the past 2 years for the world, any outbreak is best contained at the outset. So if you take the maximum precautions in the beginning, it's a lot easier in the end. And the problem being that mosquitoes transmit this virus from places of high incidence of infection. Right now, it is happening in Thiruvananthapuram, and from there, if people travel to other places, and from there, the mosquito can spread the virus to other places. So we should be very, very careful. There's no doubt about that. And then, as far as we are aware, this 24-year-old pregnant woman who got infected with the Zika virus delivered normally, and apparently the baby is healthy. There's no problem there. But then we would not expect this baby to have a neurological complication anyway, because this infection would have occurred during the trimester, because these problems occur when there's early infection during pregnancy, when the child's neurological development is in process. So it's unlikely to develop in a woman who's in the third trimester. So, but as I said, there are multiple variants of this virus, serotypes, if you may call it, or you can call it genetically there's genetic variation between Zika viruses around the globe. And the variant that is hanging around in Brazil has caused severe neurological trouble, and so we want to be very cautious at the outset. And the health department has taken it at the highest level of priority, and all diagnostic equipment is being shipped to the areas which are the referral centers at this point, which are primarily the medical colleges, and there's the National Institute of Virology in Alappuzha, who's able to handle this. So as of now, the outbreak is contained in Trivandrum.
Yes, but the central team is there as well in Kerala, trying to assist the state government in getting a strategy in place. Some important points that, of course, we are already looking at is the kind of precautions which both the doctors on the panel here are telling us that immediate priority is to prevent the Zika virus since we do not have a vaccine. Dr. Sasidharan, is there any other preventive medicine or treatment? Of course, I understand the precautionary measures that you listed, which is also running on our screens right now. But anything else that a person can do in the absence of a vaccine to make sure, especially if he lives in an area that have reported cases?
Yes, so if there is a patient of Zika virus, it's important not to touch body or body fluids or surfaces where fluids of these patients are with exposed skin. Wash hands with soap and water immediately after providing care for these patients. Many of these patients would be tested later on. When you're cleaning the sick person's environment, it's important to use household cleaners according to label instructions. Clean surfaces that have blood or other body fluids on them using household cleaners and disinfectants. These are some of the important things you will do to prevent it. And more importantly, ensure that there are no open areas, open tires, open buckets, open flower pots where water is getting stagnant, because that's how these particular the Zika virus spreads as a result of Aedes aegypti and Aedes albopictus mosquitoes, which take them, lay their eggs, and thus create this problem. So prevention and prevention and prevention is very, very important in these cases.
Yes, and in that sense, the point is that right now, of course, internal travel is not restricted. So anyone from Kerala would be traveling to other parts. And Dr. Sasidharan also mentioned that there's an incubation period within which, a person would not know if he or she is infected or not. The symptoms do not show up immediately. So all these are big challenges in combating this virus. Last word from you, Dr. Devan. In terms of the overall picture now, of course, the country is still battling the corona crisis. And this has happened in Kerala. The least that we can do is make sure that this doesn't spread beyond Kerala. But then monsoons are affecting other parts as well. So is there anything that the other state governments need to particularly do now to ensure that what Kerala is facing today does not happen in other states?
Well, picking up outbreaks like this involves a team effort. And then if there are clusters of individuals coming down with fever, and as Dr. Shashidharan correctly pointed out, if the patient has an itchy rash, a skin rash, muscle pains, a fever, and a headache, and if this constellation of symptoms is present in a region, if many people are coming in, then you could suspect the outbreak and send the appropriate serology. Sometimes you have to send it to the referral labs, and that is how the Trivandrum episode was diagnosed. And so that is being vigilant about symptoms, the symptom clusters, because remember, this can overlap with dengue, which is far more common in our country. And it's not easy to differentiate these symptoms from dengue fever. Now, people say that the only definitive difference is really the drop in platelets that may occur with dengue. For Zika virus, platelets remain normal. And for the most part, even though there are multiple papers published on this, really for the most part, symptoms overlap between the two. And as Dr. Shashidharan said, muscle pains can occur. But the point here is early detection of a cluster, prompt diagnosis to the appropriate labs that are capable of diagnosing it.
Yes, that's an important point, Dr. Jayadevan, that there are certain symptoms that overlap, which means if you see any of those signs and symptoms, it might be safer for you to do both the tests, the COVID-19 and the Zika test. And the state governments, of course, will have to facilitate that, because there would be, of course, an issue of availability of testing kits as well. Thank you so much for joining us today, Dr. Rajiv Jayadevan and Dr. Sanjeet Sasidharan. Thank you for your time.